Good afternoon, everyone. Myself, Dr. Vinod Kaushik, with other co-host Dr. Ravi Nandal and Dr. Juhi Saxena. On the behalf of IAP India Digital Team, just welcomes you all. I just showed my gratitude towards Dr. Sanjeev K. Jha, IAP President, and Dr. Ruchi Varshney, IAP Women's Health National Head, for providing us this wonderful platform for sharing the knowledge. I just request everyone, all the participants, please subscribe IAP India YouTube channel. Today the topic of our webinar is physical challenges of a postnatal mother, and we are just organizing it on the behalf of Women's Day, the Mother's Day celebration by IAP and IAP Women's Health Haryana branch by Dr. Shalinta Tyagi. Today I am also the moderator of this webinar. I will just brief out about about the Dr. Shalinta Tyagi. The ma'am is a women's health physiotherapist. Ma'am is clinical instructor at WOW IIPRE. Ma'am is certified transvaginal pelvic floor rehab specialist. Ma'am is Lamaze trained child birth educator, USA. Ma'am is certified hypnobirthing and water birthing practitioner, USA. Ma'am is BPNI certified breastfeeding counselor. Ma'am is certified mat Pilates instructor from the Ireland, and we are pleased to have you with us. And please, ma'am, continue with your webinar. Thank you.
So good afternoon, everyone. Thank you, Dr. Vinod. And, special thanks to Dr. Jha, Dr. Ruchi for giving me this platform and, speaking today on behalf of IAP Haryana team. And as we all know that second Sunday of May month is celebrated as Mother's Day. Internationally, it is celebrated as a Mother's Day. And this, discussion has come up with Dr. Vinod and Dr. Jha, and they have suggested that why not we should be coming up with a topic which is very much relevant to the mothers and especially who have been recently developed, and the time that we people are into, the COVID time. This is where, these mothers are actually ignoring their health a lot. So I would like to give a brief, what the situation is today as I am being, taking care of postnatal mothers. I'm based in Gurgaon and I'm actually taking, the postnatal mothers, their rehabilitation programs in one of the leading hospitals, maternity hospitals. And the challenge that we are facing is that because of the COVID situation, they are not getting enough attention from the staff. They are not getting the facilities because everyone is worried about, even they try to keep a distance with the people and the staff who is coming close to them. And the circumstances which are leading to is that they are going into more of mental and as well as physical discomforts, which they are not able to reach and find out about, the perfect way of how they can be out with this particular challenges, the changes that takes place in their body postnatally. So there are many mental challenges also that they have, but we would like to come up as physiotherapists, we would like to address and help them out through their physical challenges. And, since last 1 year, because of these platforms like Zoom and other, the Google Meet and all, and it has become that, the world has been very close, now that the distance between each other is not, it doesn't seem to be that far. And we can connect with all our postnatal mothers through these platforms and we can help them out. So there is no need not to worry about of the physical contact, and the right kind of education is what is needed at the moment. So the need of the hour is that every mother should be informed very well about what all the changes that has been taken in her body, and yes, how she can, take the right step at the right time so that these should not, give problems related to long-term dysfunctions. So we say, there is a saying that once a postnatal, you are always a postnatal. So once you have become a mother, then you are always a postnatal. There are certain, changes that are required to be taken care of immediately just after the birth, and there are many which are, they are ongoing, and you must have heard of many mothers complaining, and they say that, these challenges have come up after my delivery. Some of them may say that, I had an epidural, that is why I was facing this problem. Some of them say that it was because of the cesarean that I have, these issues which are there with me. So, it is the right time that we all physios should understand what all are the physical challenges and how we can actually help them to cover up. So I will start the session. I'll start my slides here. So you can. So first of all, it is a postnatal delivery body. So a mother who has delivered, now we say that she has a third body. First of all, she had when she was in a non-pregnant state. Then when she becomes pregnant, there is another body that develops into. And third is actually a post-delivery body, which is again, you will find that her body alignment is not as same as it was because of the stitches. She may be bending forward. She may not be walking properly. And also, you can see that her belly, the abdomen is actually, it is being hanging down. So all these things, all these changes are there. She may be also feeling the after pains. So uterus after pains are there because the uterus is going back into pre-pregnancy shape, size, and position. So the contractions still continue, after the delivery also. And especially when they are breastfeeding, at the time of breastfeeding, the contractions are more there. And these after pains also are being felt by them, and they feel them to be really, very painful at times, depending upon the sensitivity of a mother. Vaginal bleeding is again, the lotia that is being secreted after the delivery, and from mother to mother, depending upon the mode of the delivery as well. And it may be a little more or it may be less. The ligaments which had laxity during the pregnancy, they still continue with the laxity, and the soreness in the breast is also there. So edema, that is, the swelling is also present in the mothers. Most of the mothers who never had swelling during the pregnancy period, they find that, all of a sudden the swelling has come up. So swelling mostly in their legs and all. So they find more of the, and this usually takes time, week, 10 days time, once they start walking around, the movement and all. So this is the extra fluids that they have, the during the pregnancy that has been accumulated, the extra fluid, which actually, is being now, they can see around the ankle, the feet, and the calves. Then there is diastasis recti. This is one of the major change, the musculoskeletal change that takes place during pregnancy, the separation of the recti abdominis muscle. And this, if the, the interrecti distance is still more after the delivery, so there is a problem which is called as diastasis recti, due to which she may complain of various issues. She may complain of pelvic floor dysfunctions as well. She may complain of backache. And back pain is also something which is very common postnatally. And this was, and if the mothers who had backache during the pregnancy period also, they may also continue feeling the backaches. Hemorrhoids is one of the condition, because mostly it is being found like if a mother who has delivered normally, and if she has put in, more efforts in pushing the baby out, so there is a possibility of having hemorrhoids. She may have, the even some at times bleeding also coming out. So this is again something which needs to be taken care of. Constipation is one more issue because of the efforts that they have taken for the baby to be pushed out, because of the medicines that they are taking. They may not be having, the stools will not be passed as easily. So they may feel constipated. Many a times they have the fear of, the stitches, of breaking the stitches, whether episiotomy stitches or because of the C-section stitches. They may not, feel that putting efforts, and may, lead to constipation. Mothers who have normal delivery, episiotomy is one of the normal procedures that takes place. And when they have this cut for the easy delivery of the baby's head, the site pain is also very normal, especially during first week, 10 days time. So episiotomy pain is something which is there. Pelvic floor dysfunctions are, especially the long-term dysfunctions related to many issues, maybe because of the scar additions at the episiotomy sites, or maybe, the lacerations they had during the time of normal delivery, and the pressure of the baby, the force applied at the time of delivery, the mode of the delivery, whether it was a forceps delivery, whether it was a vacuum delivery, because of which they may, land up into pelvic floor dysfunctions. Thoracic pain is, when they are feeding most of the time, doctors are suggesting to give feed to the baby every 2.5 hours, which is, that they are mostly upright and feeding their babies. But due to, improper posture, they may have thoracic pain. Epidural site pain. Epidural is one of the ways of, taking an anesthesia in their back, so that they should not feel, the normal delivery pain to be on a higher side. So it reduces the intensity of the pain. So this epidural pain is being felt by them, the site where the injection is being given. So they feel at times the pain over there. Also the C-section site pain, so where the cuts have been given. Coccydynia is one of the common complaints. During the normal delivery also, when the baby is pushing, baby is coming down, he pushes our coccyx, and the mothers may feel the pain. They are not very comfortable sitting on their buttocks, and they may have the feeling of coccydynia. Fatigue is very, very common because of the, change in the entire schedule that they had before the birth of the baby. Fatigue is very common, and now they have sleepless nights, baby crying, changing diapers, and all those things. So they are not able to feel energetic most of the times. And hair loss is one of the common complaints that they feel mostly, by the time they reach third, fourth month of the postnatal period. So as I started with that, there are, yes, the psychological and emotional changes as well, but we would be taking care of discussion of the physical changes. So anxiety is the one common complaint that is mostly felt by all of them, and it is very, very normal to get anxious about, whether I would be able to hold my baby properly, or I should not be dropping my baby. Am I a good mom? Am I, feeding my baby properly? Is he getting enough feed? So all these questions are always there in the new mother's mind, and she may have the anxiety. That is okay. So a support person, so we, especially the physios who would work towards the postnatal part, they can provide that support, mentally motivating the mothers, and they can be taken out through very easily. Postnatal depression is, when this anxiety takes week, 10 days and a little bit more. So they land up into a state of depression where certain challenges, maybe of the physical body challenges, maybe of the breastfeeding challenges, or any other family issues, which makes them feel very uncomfortable. And due to the changes in the hormones also, now the postnatal, there are many hormones which are, which have been started circulating. So we are not going into depth of the hormones, but yes, because of the change in the hormones now, they may start feeling a little demotivated and depressed if they are not able to, especially take care of their baby as they wish to, as they wanted to. And also what happens, once the baby is born, everyone, the attention which was there for a mother, during these 9 months, a pregnant mother, now it shifts to the baby, and they feel that, we are no more important in our family. So that is how this depression comes up. And if by any chance any of the, physiotherapist who is attending a postnatal mother during the first few weeks, and she happens to feel that the discussion that that mother is giving, there would be some signs of the kind of sentences she's using, not saying that I'm not feeling good, I'm not happy, and you would be able to judge about it that she's not, she is landing up into depression. And this should be the time when the family and the members of the family should be informed about it. And if it is being not taken care of, then it may land up into maternity blues. Most of the time, the mother is, upset. She doesn't feel good. She doesn't feel like changing herself, dressing up, holding the baby. She's not feeling good. And to the worst part of it is psychosis. So in that state, she may even feel like, killing herself, or she may even feel like killing her baby. So these kind of the changes are also there, and it is not limited during the initial days. It may be later on also, like the first 1 month, 1.5 year of the birth of the baby. And especially now, the time of COVID, you people can understand, the the mother is, the first of all, the help part. Now we don't have that excess of easy help, having too many people around helping the baby, helping the mother. So first of all, that is not there. So she's managing everything with her postnatal body, managing the baby, managing the house, and plus now the challenges would be, the baby not getting enough feed. So if somebody in the, family will say that we used to get good amount of feed and why not you are getting it, that will make her more demotivated. So this time is actually, we should be more supportive to all the mothers and making them understand the importance, and leaving the decision onto her, because we can't just judge a mother that she doesn't want to feed, or she doesn't want to take care of the baby, or she doesn't want to hold the baby. We can't just make sentences onto her. We have to understand there would be some circumstances, right? Everyone has their own stories, everyone has their own struggle times. So we should be very careful when we are giving suggestions, when we are counseling them, whether it is related to their body, exercising, or it is related to the breastfeeding part. So emotional, psychological part, though it is of a intense depth, but it is equally important for us physios to understand that what all changes she's going through at the moment. So coming back to what would be our role as physiotherapist. So we will do a kind of, we can do both a subjective and objective assessment of a mother. If we happen to, she comes to us for any kind of problem, whether it is back pain, thoracic pain, or she's having any kind of pelvic floor dysfunctions. And then we have the next one is to help her out with the posture re-education, the wound healing, whether it is the episiotomy stitches, or whether it is C-section stitches. So we can help her into the wound healing part, establishing the breastfeeding, pain management, and help her out with the exercise plan. So very important is, the posture re-education or the ergonomic principles. So this will apply to, her sitting. So now, like, if she had a normal delivery or she had a C-section, in both the cases, she will not be able to sit, upright and, up throughout the cases. There would be some pain around the stitch line, whether at the episiotomy or at the C-section site. So we have to, help her out with the sitting, that yes, she should be supported with the help of pillows, or if she requires, she should be given a back support. And the weight should be evenly distributed. Because of the episiotomy pain, what happens is they are mostly, putting pressure onto one of the sides of the buttocks, and they are not sitting on the side they had a episiotomy cut. So there would be a sitting surface, a donut pillow. Those things can be used by them. And that even the trunk should be fully supported. And the support should be given to the back is not, they are not bending forward. We will have some pictures of, the feeding positions also. So if they are standing for long, say they should be standing, with their feet apart, putting equal weight on both the sides, soft knees, relaxed shoulders and other body part, maintaining a natural curve of their spine. And Also, then lying position. So for the lying, they can use, a number of pillows under their knees. Side lying position also, they can have a pillow between their knees, and they should try and avoid legs to be, in a crossed position. Most of the work that they should be doing at the kneeling level. Now with the baby, it will be like they have to change the diaper, they have to give back to the baby, they have to, pick up the baby from the lower area, maybe that from the bed, or the crib that they are using. So they should always try to kneel down, or they should squat down and try to keep their back straight. Mostly if the back is straight, that is the best thing to be done. And then they should lift the baby, so changing diapers and giving bath and all those things. If they can have a diaper changing table where they will help, allow the baby to be on top of it, and then do the changing and all, which will help them not to bend forward, and further which will help, for the strength, not having any kind of back issues. So kneeling is the most comfortable position to give the changing part of the baby's diaper and everything. Coming back to the feeding part, so mother may be feeding sitting on a chair, or she can use the bed. So in the sitting on a chair also, we can try and give her, support of the pillows. She want a side support in a football hold, or she want to give a sideline position. So here are some pictures that are being used. So just to give you an idea that how you can use the pillows, where all you can use. And back should be comfortably supported all the times, so that they can, they don't have the issue of thoracic pains. So as we were discussing about the kneeling position, so you can see here the leftmost position. This is how mostly the mothers, they forget about themselves. And when the baby is crying, baby needs a nappy change, or baby needs a pickup, so they just bend forward, they hunch, and then they are doing the nappy changes and all, which is not good for themselves. So it should always be in a kneeling position, or they should actually have a diaper changing table where they can hold the baby and, do, because it will take 5 to 10 minutes for them to change the diaper. It is not an easy way, just a few seconds work. So it is always advisable to keep their back straight. Coming to the bath time, same thing. So instead of bending forward, they should try to kneel down and then do it. Then coming to the perineal pain. So initial perineal pain we will be talking of now. So we can, when we happen to, for physios who would be working with closely in the hospital setups, maternity setups, where they get a chance to see the postnatal mother. So they can have, look into the whether there is a bruising, there is edema, the stitches are tight, or there are some labial tears, any kind of infection, and any breakdown of sutures are there, or hemorrhoids problem is there. So these common things are there, which can be managed very easily with the help of posture education, helping them with the pelvic floor muscle exercises, applying ice or the warm baths, whichever is more comfortable for them. And also ultrasound can be given to them as a therapeutic way. So now coming to the posture re-education, as I was saying that, initially just after the birth, it will not be easy for a mother, both the mothers, whether they had a normal delivery or a C-section delivery. It won't be very comfortable for them to, sit straight upright. So the suggestion, goes them to go into a laid back position. So when they are in the laid back position, the pressure is off the stitches, both the stitches, and the baby can be positioned in a way that baby is chest to chest onto the mother and very close. And it is very good for the eye contact also. So it helps in the bonding of the mother and baby. And she can use this position for feeding and resting instead of sitting upright throughout the time. So back is still this straight, back is going to be still straight in this laid back position. It is not going to be hunched, but it is more comfortable position as compared to the other position. Now coming to the pelvic floor muscle exercises. So the first thing is the immediate postnatal care. Let's always discuss with the gynae. That thing should be always kept in our mind. We should take a permission from her. And very gentle pelvic floor exercises. Thus only, you can start with contraction and relaxation of pelvic floor muscles, that is okay, which will help in, both the stitches healing. They help in the episiotomy stitches to heal faster also, and same way for the C-section stitches also to be healed. So this is something which can be started immediately after the birth, and mother can initiate, and she can take a permission from the doctor and can start with that at a very low intensity, right? And if they were used to of doing this antenatally, if they were there with you antenatally and you have explained them the importance of Kegels exercise or the importance of the pelvic floor muscle exercise, then it becomes even more easier for her to do it. Because otherwise, if she'll be doing it for the first time postnatally, so there is a possibility that she may not understand it as easy, because she have that fear of hurting herself at the site of the stitches. So but otherwise it will be very easy for her to understand if she has done antenatal period. Ice application, so the area where the episiotomy stitches are there, so their ice can be applied into a damp disposable gauze or into a disposable washcloth. You can put in ice over there and can be given at the 5 to 10 minutes for the affected area. Or she can herself also do a ice cube massage over there, so it helps into the the releasing of the burning sensation that she has. Even warm bath is something our grandparents, the grandmothers and mothers, they used to suggest. It is it promotes a kind of hygiene and also pain relief. So depends, some mothers, they are very comfortable with hot water, and some others they want that I would go for a cold pack. So depending upon that, we can actually use a ice cube or a warm bath to be given to them, to have a good burning, help to relieve the burning sensation, and also giving a relaxed feeling. Ultrasound, the device that we physios use, can also be used under infection control protocol. It helps in increasing the repair part and can be given for 2 minutes, per head size of the trauma. Now, coming to some genitourinary dysfunctions, that means incontinence, especially the fecal incontinence and stress incontinence. There can be constipation that she may feel, she may have urinary retention, she may also have an urgency. So these kind of complaints can also be, taken care of by our physios, and we can help them out. So if she had a instrumental deliveries, or she had multiple deliveries, it is being found that the incontinence fecal is very, very common during them. And if some mothers are being given as midline episiotomy, so these days it is more that the lateral episiotomy is given, and we don't promote as a midline episiotomy. So that increases the risk for up to 3 to 6 postpartum months postpartum. So it is not so easy to heal this midline episiotomy, and mothers, they may feel the leakage of stools, and it is not under their control, and this kind of complaint can be there, and it can go into as a long term dysfunctions also. So the first thing to be started is, yes, the pelvic floor exercises. They should be started as soon as possible after the birth of the baby. Constipation, again, it is one of the common thing that is there, and it can also be a result of weak abdominals. So if a mother who has gained a lot of weight after the delivery, or she has not done any exercises, and she was not an exercise person, she has weak abdominals, so there is a possibility that she may have the constipation. And also it depends on the intestine muscles also. So what all kind of food they are eating, they are not providing much pressure, and all those things can lead to constipation. So for this, we can help them, with walking. We can help them with starting with the abdominal. Even the massage is being given onto the belly, so that their motion can be started. The high fiber diet is something which can be added in their diet. Then is urinary retention. So many mothers, they may have this urinary retention problem. And recently, one of the mothers, who delivered, she was with me. throughout antenatally and at the time of birth also. She had a very good experience of the birth, and she delivered the baby normally vaginally, and she was very happy that she didn't take too much of a time. But yes, she suffered with the urinary retention later on. It took her almost 20-25 days to come back, onto a normal cycle. So she was not able to pass her urine completely. So here, there is many a times there is not much that can be done, but we can always help them with the reassurance, and an explanation of what has happened with her. There was a pressure, the bladder must have been pushed, a little bit backwards when the baby was coming out. And this is something which can, the bladder will come back into their position again and things will be normal. So this kind of reassurance is something which is required, and we should know about this, that this is some of the very common complaints that come out, and they are treatable. So here the role of the urologist will also come, but it is more of that, yes, we can start up with the pelvic floor contractions, gentle pelvic floor contraction and relaxation exercises, and also help her with the breathing and the relaxation on expiration when she is trying to pass urine. So such techniques can be helped, that can be taught to her, which will help her. Then there is urgency. This is one at, the pelvic floor dysfunctions that we have, especially for the bladder part. So they have the increased feeling of, needing to empty the bladder. And again, there could be a possibility of trauma uh, uh, while the baby was being delivered at the nerve supply. And here also, we can actually start them with the basic muscle exercises, pelvic floor muscle exercises. That is the first thing to be started in all these cases. Now, coming to the musculoskeletal dysfunction, because these are the two major dysfunction. One is the pelvic floor dysfunction, and the another one is the musculoskeletal dysfunction. So these are the two major changes that they have. And in this musculoskeletal dysfunction, again, we have, like, the problem like diastasis recti abdominis, they have back pain, pain at the site of epidural, thoracic pain, coccydynia, symphysis pubis pain, and after pain. So now this diastasis recti abdominis, this will be present in all the mothers who have been pregnant and now they are postnatal. This will be present with all of them. The condition and the severity of the condition will vary depending on many factors. How much was the weight they have put on, their age, their posture, their work, the daily routine, how they are handling the baby postnatally. So these things will decide the severity of the diastasis recti abdominis. And they can actually also interfere with the supportive and expulsive function of the abdominal wall. And this usually in most of the postnatal mothers, this settles, between 6 to 8 weeks. So maximum cases by 6 weeks, it will come back. So which we say that normally it should be, 1.5 finger. We do a finger test for the diastasis recti separation to be checked. So it is, they come back to 1.5, but in some cases, it may be that there is 2.5 fingers or 3 fingers and 4 fingers. And you would be surprised to know that, mothers who approach me after 3 years of the birth of the baby with 4 finger diastasis recti and, free flow 4 finger diastasis recti, and they were having this problem of, that the bulge, the muscles are weak, they don't have the, the muscles are not toned enough. So we can actually help them out, with this. It is not that it is not treatable. The sooner we start the therapy onto the abdominis muscle, it is going to be better for them. And abdominal retraction is something which should be started immediately just after the birth. So the abdominal retraction is just pulling your abdominal muscles inwards towards your back. So you breathe out and pull your muscles in. That is the most important thing that can be done. Back pain, which is there for 67% of women, they have, after the delivery, they can have various causes which they can relate to, uh, with the epidural site pain or a C-section or, the posture. So here we will have our interventions with like posture re-education, back support, they can rest in prone, and the exercises can be taught to them. Epidural side pain, as we have discussed, we can use a hot pack or we can use a cold pack for them, depending upon the what they like. They are comfortable with hot packs or they are comfortable with the cold packs. So thoracic pain is mostly with the sitting position while breastfeeding. So in this particular case, we will help them out with posture re-education, and hot or ice packs can be given to them when they have thoracic pain. Coccydynia, here, the fracture during the second stage of the labor, or if it is not fracture, there can be just the damage to the ligaments also. So we can give them ultrasound, we can give IFT, TENS, and also depending upon the liking of hot and cold pack. Many mothers, they feel that cold pack help them more than the hot pack. So please go ahead and ask them, take their views, and you can suggest them accordingly. Symphysis pubis pain. So this is actually, the pain at our, this is similarly to the condition can be there as the diastasis recti. So we have diastasis pubis separation also. Depending upon, when the baby was coming out, if the pressure was more there and it was a traumatic delivery, so they may have the separation here also at the symphysis pubis. But if it is, normally at the time of delivery, because of the pressure, if there was a lot more pressure being applied, and many a times it happens, when there is a normal delivery, the OT technicians and other nurses and all, they give a little bit of fundal pressure with the contractions. So when this fundal pressure is being given, there is a possibility of, having more of the pressure onto the symphysis pubis, and this can lead to the pain later on after the delivery. So joint separation can be either sudden because of the fundal pressure, or it can be gradual, maybe because, at the time of pregnancy, especially during the third trimester, depending upon the weight gain, depending upon the posture and the activities they were doing, it can be of a gradual onset also. So this pain can be mild to moderate, or it can be severe and disabling also. So we have seen mothers postnatally, they are not able to walk, they are not able to stand, and the conclusion that comes out to be as the symphysis pubis dysfunction. So now, depending upon their severity, they can be given rest, they can be, helped with gentle mobilization techniques. Even ultrasound can be given to the area where they are feeling the pain. And they should be avoiding any kind of non-essential weight bearing, abduction of their legs and one leg standing, twisting, lifting. All these things should be avoided by them. So as we were discussing about the after pains. So after pains is actually by the uterus, when the uterus is contracting and going back into pre-pregnancy size, shape, and position. So this is where she feels into the abdominal, area. And most of them are going to, come up with this, that whenever they are feeding, even many mothers, they refuse feeding the baby because they feel them to be more when they are feeding the baby. So gentle relaxation breathing exercises can be advised to them, and if required, TENS application can also be given to them. So there are certain other dysfunctions related to the circulation. The varicose veins is there, edema, then there is superficial and deep vein thrombosis and hemorrhoids, as we have discussed earlier also. So for varicose veins, we can ask them to do alternate dorsi and plantar flexions. They can use support diets. And for them, we can help them out with the posture re-education, no cross leg sitting. And they should be supporting both the feet onto the floor, or they should be resting it on a table so that they are not hanging down. And same goes with the edema also. So there can be massive diuresis after the delivery, and which can actually make the fluid retention after, for days after the delivery. So these can be also supported with the support stockings. And again, we can help them out with foot and ankle exercises, posture education. Yes, how should they sit? The legs should not be hanging throughout. They should be walking often. standing on their toes, back onto their heels. So these exercises can be suggested to them. For hemorrhoids, as if they are distended out and also thrombosed, veins in the anal region, for them we can apply ice. We can do the ultrasound, following the infection control protocols. Here again, we can help them with posture. Pelvic floor exercises can be started here. And this problem is majorly, as we discussed earlier, also is related to the second stage pushing of the baby. If it was being, very forceful push or very hard push, that can actually lead to the hemorrhoids. So the suggestion goes here as well. They are also treatable. Initially, we should always, help them out with the reassurance, and good counseling needs to be done. First of all, for anything, for any problem, if they understand what exactly this problem is and how it has come up to them and how it can be relieved of, that education is something which will actually take out their 50% of pain relief. They will actually heal 50% if they understand what has actually happened. Many of the time, the pain of, the fear of what is happening to their body and what has suddenly happened, which was not there earlier, that makes it more complex. So we should always try and help them out, educating first, and then we can help them out with the solution to the problem. So for the breast problems, we have like breast engorgement, then there are sore in the cracked nipples. So this is again, if they are not feeding the baby properly, and there would be sudden, the milk supply has increased, which will lead to breast engorgement. And for this, we as physios, we can help them with warm compress, massage, expression of the milk, and also many a times ultrasound is given, to increase the circulation over there and help the expression of the milk. For the fatigue part, as it is a normal symptom, we should suggest them to more oftenly take rest, sleep with the baby, get up with the baby, not to do much of physical exertion after delivery, and to take good care, and the best thing is, that they should accept help. Mothers, they try to do everything. So especially now, on a Mother's Day, we are, all the moms are being said as, they are the multitaskers. So she tries to become a multitasker at this moment also, postnatally. So she would like to do the cleaning also, feeding also, burping also, making the baby go to sleep also, and many other things. So this should be an advice to a mother that it's okay to take a rest. She should not feel that she's not doing all the work related to baby. It's not only her responsibility. There are people who would be helping her, and she should be ready to accept the help. C-section care. This is something which is very important, because this is not just as, a baby has been delivered through C-section, it is also a major abdominal surgery. So from the point of physiotherapy management, we can help them out with exercises, we can do the massage, feeding positions, helping them out, helping them in wound healing, and what correct posture to be done. So as physio, we know that, gentle pelvic tilting, rolling to the sides, heel slides, abdominal breathing, and pelvic floor muscle contraction should be initiated as soon as possible. Some massage can be given, at the area where they feel a little bit of pain, and also at the line of the colon, so that they are not very constipated. Feeding positions, the laid back position can be explained to them so that it helps them, to relax. And women with pendulous abdomen, they should actually hold, the belly in a way, it should be away from the wound. So we have to help them out. We can suggest them to wear belts, support belts, and help them to encourage with uh, educate with the posture. They should not be, when they are coughing and sneezing, they should always, cross their hands. They should support their abdomen, and then they should slightly bend forward and try to cough and sneeze, and encourage forceful exhalation instead of coughing, and use the belt. Now, the most important thing, we all physio know that, exercises are going to help, posture is going to help, But we have to, consider that whether the mother, she is, what would be her present state, mental state, whether she is interested in exercise or not. We should not be forcing her. We should not burden her with too many exercises. Just give her two exercises in one day, explain her with, good posture, and that is enough. Let's not overload her with too many exercises. And also, it can be, there is a possibility that the mother who is postnatal, she may have a sick baby, or she must have lost her baby. So we have to keep many things in mind before we are suggesting them, any exercises. So encourage them movement. If they are not ready to exercise, at least encourage them to move around and to take enough fluids. So contraindications for the exercises, yes, if they are having heavy bleeding, they have too much of pain or infection in abscess, or they had a very traumatic vaginal birth and cesarean birth, yes, we have to take care which exercise to start with. If they have any kind of breast discomfort, or they have heavy urine leakage or pelvic pressure, then we should not be make them exercising. So we have certain dysfunctions that we have discussed, like stress incontinence. There could be vaginal pain, dyspareunia. The penetration becomes difficult. Diastasis recti abdominis and diastasis recti pubis, back pain. They can also have carpal tunnel syndromes, mastitis, breast abscess. So we have already discussed the pelvic floor dysfunction. So need not to go into the depth of the muscles, but yes, we can start with the pelvic floor exercises. If they have loose pelvic floor muscles, or they have dyspareunia, that means if they have tight pelvic floor muscles, or they have adhesions, we should always take a permission from the doctor, the treating obstetrician, and we can start with the pelvic floor exercises and help them out to, to come out of this discomfort of pelvic pain. So the reasons we have already discussed, why there could be a reason of pelvic floor dysfunction, if it was a forceps delivery or it was a vacuum delivery. So yes, we would be educating them posture, we will be educating them, how to lift and carry objects, and also the alignment of the spine. And after that, we should be also helping them out with the exercise. So abdominal support that I was discussing, for the C-section mothers especially, that can be started immediately and can be, they can wear it till 8 weeks postpartum. And it should be wrapped from bottom and up, right? So the, the pendulous abdomen, which is lying down onto the, over the wound, that should be supported first, and then the support should be coming to them. So posture, we all know that how we have to help them out, and the abdominal exercises. So the abdominal exercises, we should be starting them. So they should not be full crunches. So we need to first go for a check of diastasis recti and then only suggest the first level of abdominal exercise. And there is a variations of the diastasis recti. So at the umbilicus, there can be a separation, or there can be separation below the navel, and many a cases there is separation only above the navel, or there can be complete diastasis recti. So taking a, good care of what the diastasis recti and how it is, this is a finger examination that we do to check for the diastasis recti. So if we know that where exactly it is, and then only we should plan with the exercises for the abdomen. Also, the more important thing is to make them understand what exactly the core breathing means. So that means if they have to inhale, when they are inhaling, so there will be an expansion of the abdomen, and the pelvic floor muscles will be relaxing when they are breathing in. When they are breathing out, they should feel the pelvic floor muscles, they are contracting, and also the abdominal wall is actually contracting. It is kind of going and touching to the back. So there will be a tension in the abdominal and back wall when they are exhaling. When they are inhaling, there will be an expansion. So this kind of breathing is very, very important to be started as soon as after the birth. We should initiate this because this is where they go wrong mostly. Back pain, we all, as physios, we know that, how we can help them with the back pain. That can be because of the epidural analgesia, that can be because of the wrong postures that they are doing with the baby, or that can be because of the changes in the bone density, because of lactation. So we have to help them out with the back strengthening exercises. So the back strengthening exercises we all know and we can start. But here there is a catch here, that if it is a C-section, so we have to always take care that when we have to allow them to be onto the prone position, so at least wait for 3 months before making them go onto the prone position, the sensation they have at the C-section site, and then only we should start the exercises when they are in prone. Otherwise, they can do the pelvic tilts in the kneeling position. The kneeling position exercises can be performed for the C-section mothers. So this is all what I have tried to cover, mostly all the topics that they suffer postnatally, and we physios, we can actually help them out. It is not that because of this COVID, when we are not having a physical consultation and we can't help them out, we can have Zoom consultations with them, online consultations with them, and suggest all the mothers, reassure them. And it is not that those who have just delivered within 1 month, 6 months, the mothers who are reaching you later on also, so we can help them out with have the certain protocols, checking their for the diastasis recti, checking their posture, their daily living activities, and we can help them accordingly as per the complaints that they are showing us, whether it is back pain, whether it is a pelvic floor dysfunction, whether they are able to, not able to hold the urine, and those kind of complaints that they are come up, or they have difficulty in penetration, so they are not able to have a good sexual life. So all these kind of things are again, a part of postnatal rehabilitation work that we all physios can do and help them educate. And let's pledge on this, 2021 International Mother's Day celebration through our team, that we will be supporting all the mothers to understand what all changes have taken in their bodies, and let's not ignore them. That is what we Indian mothers are good at. We are good at ignoring ourselves, and we take care of our babies first. So we, as babies of our mothers, let's promote this education and let it be there with every physio, let it be there in every house, that they understand the importance of posture, understand the importance of strength at the pelvic floor, understand the importance of strength at the back and their abdomen. So that's all. Thank you very much once again. Thank you, the team, to give me this opportunity to come on this platform and share the knowledge that I have been, gaining. I have experienced in all these 16 years of my work that I have been doing in women's health. So, Dr. Kaushik, are you there?
Thank you so much, ma'am, for such a wonderful knowledge that you have shared with us. And here we are having questions for you from one of the attendees. And it is, ma'am, I have one doubt. If we feed baby in chest to chest position, is it safe for baby?
So what exactly are you want to know? What is not safe here? Like chest to chest is...
This is from one of the attendees. So I'm repeating as they have written is, ma'am, I have one doubt. If we feed baby in chest to chest position, is it safe for baby?
That is what I'm asking, that why do you feel that it is not safe for the baby? So what exactly do we mean by chest to chest? That is important to understand. So when we mean chest to chest, means the baby is close to the mother's chest. So baby's chest is, touching the mother's chest, right? Otherwise, when we are positioning the baby, there is a gap between the mother and the baby. There is enough gap. And baby is most of the time lying, the chest of the baby is facing the wall. He's
yes,
not
ma'am.
facing
The
towards
attendee has explained it a little more. They are asking if there is any regurgitation of milk.
No, there is no possibility of any regurgitation, but yes, we should always suggest them that after they have actually given feed to the baby, they should always keep the baby in upright position, whether the baby is giving burp or not. We have to keep the baby in upright position for at least 5 to 10 minutes. So that takes care of any kind of throwing up of the milk and regurgitation.
Thank you, ma'am. I hope the attendee's question is answered. So I would like to thank you. I'd like to thank Dr. Shalinta, ma'am, for presenting such a wonderful webinar and giving us an insight on what a mother goes through and how to be a support to them. And I'll extend my thanks to Dr. Vinod Kaushik, sir, who has been the moderator for the session today. And thank you to all the attendees who are here. I would request everyone to kindly subscribe to IAP YouTube channel for further more webinars. And thank you. Have a good day and happy Mother's Day to all the mothers in advance. Thank you all for attending.